ask you about Obamacare. Former President Trump said he wants to repeal and replace Obamacare, something he tried and failed to do when he was president. You were in Congress at the time. If you were president, would it be your plan to try to repeal and replace Obamacare, something you voted to eliminate 3 times?
Well, you're right. President Trump promised that he would repeal and replace Obamacare, and he didn't do it. And that was a promise that he made a lot of times.
What would you do, Governor? What would you
costs
do?
have continued to go up. Well, but I think it's important to point out he's running on a lot of the things he campaigned on in 2016 and didn't deliver it on, whether it's repeal and replace Obamacare, whether it's building the border wall, whether it's draining the swamp. Remember, he said he would do a special counsel against Hillary Clinton. Then 2 weeks after the election said no. Now he says he's going to do one against Biden.
Understood,
so
but
this
Governor,
is part
what
of
would
a pattern
you do?
where he's running on things that he didn't do. Here's what I will do. What I think you're going to need to do is have a plan that will supersede Obamacare, that will lower prices for people so that they can afford health care while also making sure that people with pre-existing conditions are protected. And we're going to look at the big institutions that are causing prices to be high. Big pharma, big insurance, and big government. But it's going to need to be where you have a reform package that's going to be put in place. I don't think that repeating what Trump did and the failure is necessarily going to make sense. So we will address that. We will make sure that the Obamacare promised lower premiums. It didn't deliver that. We know we need to go in a different direction, but it's going to be done by having a plan that's going to be able to supersede it. And
Governor,
we will be working on that.
I want to be clear by what you mean by supersede. Do you mean you will move to repeal Obamacare and try to replace it with something else, or will you leave it in place and make revisions?
No. You will have a totally different health care plan.
So you'll repeal it?
But what
You'll
it will
move
be
to
is
repeal it?
people that will be on things like if they have an exchange plan, we'll have a plan that will offer them coverage. So the coverage will be different and better, but they're still going to be able to be covered. So we want to make sure we have as many people covered as possible at the lowest possible price. And like in places like Florida, I mean, we already have. I signed pre-existing protections anyways. And so I know that that was like a big deal with Obamacare, but that's an easy thing that we'll agree on. So that's not a big deal. So it's going to be, we're going to have a plan. I think it's going to supersede Obamacare. It's going to be much better for people.
I just want to be very clear, though. Are you going to keep Obamacare in place and make revisions to it? Is that your plan? Just to be crystal clear.
This will be replacing Obamacare.
So you'll repeal it and replace it.
We need to have a health care plan that works. Obamacare hasn't worked. We are going to replace and supersede with a better plan.
Can you tell me specifically what the plan is and what your plan is to ensure the 40 million people who now have health insurance who didn't before Obamacare was passed?
Well, we're going to be working on probably in the spring. We'll roll out a big proposal. I've got a lot of input that's been coming in from a lot of good people around the country. But we will definitely be addressing insurance. We'll definitely be addressing big government, and we will be addressing big pharma. You know, we pay more for drugs in this country than anybody else in the world. I'd like to see some equity across these developed countries so that our consumers are getting relief. Obamacare promised that. It didn't deliver. So we're going to do something that actually works.